Hi everyone, so today we'll be doing the mock USMLE question of the day number 4, starting off with the patient presentation. So Ms. Johnson is a 67-year-old female. She's admitted to the hospital for a left intertrochanteric femur fracture. She successfully undergoes IM nail placement. On post-op day 2, her laboratory findings are notable for a significant drop in platelet count from 200,000 to 90,000. And the question is, what is the mechanism of action of the drug most likely responsible for her laboratory findings? The options are activation of antithrombin, inhibits vitamin K dependent coagulation factors, ADP receptor inhibitor, or GP2B3A inhibitor. So go ahead and take a second to pause the question if you need more time. The correct answer is activation antithrombin 3. So in order to answer this question, what you have to infer is this patient in the post-op setting was likely given heparin. One of the common side effects of heparin is heparin-induced thrombocytopenia, which, similar to what we see in our patient, can cause a rapid drop in platelet count. And heparin-induced thrombocytopenia is defined usually by a drop in platelet count more than 50%. So the fact that this patient's platelet count drop went from 200 to 90,000 is very consistent with this presentation of heparin-induced thrombocytopenia. And to be able to actually answer this question, what you have to remember is heparin works through the activation of antithrombin 3, which in turn causes degradation of factors 2 and 10, making option A the correct answer, which is once again activation of antithrombin. Look at option B. The reason it's not correct is it mentions inhibits vitamin K dependent coagulation factors. This is the mechanism of action associated with warfarin. Once again, that's not associated with heparin-induced thrombocytopenia. The last two options are ADP receptor inhibitors and GP2B3A inhibitors. Both of these drugs work by preventing platelet aggregation, and once again, these drugs are not associated with inhibition of vitamin K dependent. The last two answer choices are ADP receptor inhibitors and GP2B3A inhibitors. Both of these drugs work by preventing platelet aggregation, and this wouldn't be a correct answer because neither of these drugs are associated with heparin-induced thrombocytopenia. Lastly, I just wanted to talk a little bit more about heparin-induced thrombocytopenia and highlight the key points that you should know. So essentially what happens is patients, when they give heparin, often what can happen is your body can form these antibodies against the platelet heparin complexes. The formation of these antibodies eventually leads to a significant drop in platelet count. And what's very high yield to know is when these antibodies attack these platelet heparin complexes, they can lead to destruction of those platelets, and they can actually release procoagulant material, which can in turn which are associated with increased risk of arterial and venous thrombosis. And because of this, heparin-induced thrombocytopenia is associated with a high risk of mortality. Very important to know. And the main thing you want to remember is if you have a patient who does have HIT, what you want to do is immediately stop heparin and then start an alternative anticoagulant like direct thrombin inhibitors. And that is going to be it for today.